Very good, ladies and gentlemen. You're very, very welcome to this next session on metabolic disease. So with the interest of time, I think we'll make a start. So first up in this session, we have a speaker, Sabine Mann, who's come from the University of Cornell, originally from Germany, and a diplomat of the European College of Bovine Health Management. And Sabine's topic, the title of her presentation, is Prepartum Plane of Energy in Dairy Cattle, the effects on production, energy balance, glucose tolerance, and adipose and muscle tissue insulin signaling. Over to you, Sabine.
Thank you for the introduction. Good morning, dear colleagues. I'm very pleased to be able to present some of our recently completed research to you today. And as you're coming in, I think you probably heard the introductions this morning, so I can go over these pretty briefly. As you know, in the week before calving compared to the week after calving, the energy demands of lactating dairy cattle more than double. At the same time, the cows go through an untimely and voluntary drop in dry matter intake that is up to 30% of their intake before calving, as you can see here on the screen, with a pretty dramatic drop around the day of calving and a slow increase at the time after calving. Taken together, the increase in energy demands and the drop in dry matter intake create a negative energy balance. And we see a rise in the markers of negative energy balance that you've heard about this morning, which are NEFA and BHB, non-esterified fatty acids coming from adipose tissue lipolysis, and BHB, one of the gold standards for measuring ketone bodies in the body. So as you see, NEFA has a sharp rise the day of calving, as we've heard from Dr. Rehage this morning, due to all the stimuli around the day of calving, and then BHB is rising with a little bit of a time delay in the first week after calving. We know from epidemiological studies that an excessive increase in these two markers is linked or associated with downstream health events that are negative: less production, increase in displaced abomasums, and increase in the risk for not getting these cows pregnant. So insulin is playing a central role in the metabolism in the peripartum dairy cow. Insulin plays a key role in partitioning energy around this time. Insulin also has a strong inhibitory effect on lipolysis. At the time of calving, the action of insulin is reduced, and that allows NEFA levels to rise and to enter the liver to be used for different sources there. One of these pathways that NEFA goes through will yield ketone bodies. Other ketogenic precursors, for example, coming from muscle proteolysis, will also give rise to an increase in ketone bodies. Research over the last decade has shown that overfeeding energy to dry cows increases the concentrations of NEFA and BHB postpartum. However, exactly why this is happening has not been fully elucidated thus far. So the focus of my PhD thesis was to see how insulin is acting in relation to these different dry cow feeding strategies, overfeeding energy or feeding a controlled energy diet. So the way we did this is we set up a model where we fed one group of cows a controlled energy diet throughout the whole dry period, and a second group which received a typical two-group or step-up approach, also being fed a controlled energy diet during the far-off period, and then receiving an intermediate step-up diet in the close-up period. The third group received a high-energy diet throughout the whole dry period. Because there's inconsistencies on how we handle energy densities around the world, I'm just going to go with presenting this in percentages of energy requirements. So this would have been 100% in the controlled energy diet, and then 100% in the far-off period in the step-up group, up to 125% in that stepped-up close-up period. And then the high-energy group would correspond to 150% of energy requirements. At 4 time points throughout the transition period, 2 times before calving and 2 times after calving, we carried out intravenous glucose tolerance tests. This was in order to study how the cows would respond to a glucose stimulus and also how much insulin they would secrete to deal with this glucose challenge that we were giving them intravenously. At the same time, we were taking subcutaneous adipose tissue biopsies immediately before and 60 minutes after the infusion of glucose. This was done as what we called in vivo model of tissue insulin signaling, as we knew that the glucose bolus would induce an endogenous insulin release, and thus we were studying the gene expression and protein expression in the adipose tissue following this insulin release. The first piece of data I'm going to show you is the intake data. And as you can see here on the left graph, which is showing the intake in kilogram of dry matter throughout the prepartum period of 7 weeks, you can see that the high energy group ate more than the controlled energy group. The groups are always going to be presented in the same colors, with the high energy group in black and the controlled energy group in red, and the intermediate group in blue. As you can see, the intake of the intermediate group slightly increased when we switched them to the higher energy diet, and all 3 groups decreased their dry matter intake just before calving. Postpartum, there was no difference in dry matter intake. Energy balance follows closely to what we have seen in the intakes. It's not surprising that the high energy group, being fed a higher energy density diet and also having a higher intake, has such high energy balance prepartum. I put in the line here at 100% of requirements, and as you can see, all 3 groups were in positive energy balance throughout the dry period, except the controlled energy group, which dipped under the 100% line in that last week before calving. Also, as expected, all 3 groups were in negative energy balance postpartum. And we have a little bit of a separation here numerically between these 3 groups, with the controlled energy group being in slightly less negative energy balance. Because energy balance is tightly linked to not only intake but also milk production, I'm going to show you here the milk production data. This is throughout the first 6 weeks after calving. If you just look at milk production without energy correcting it, as shown here on the left, you see that the 3 groups are pretty much on top of each other. There's absolutely no difference in the milk production. However, when we fat and protein correct the milk, you can see that the high energy group is slightly separating, particularly in the 2nd week postpartum. I don't have time to show you this today, but this is mostly due to an increase in milk fat percentage. And we trace this back with looking at the sources of the milk fatty acids, and this seems to be due to a higher increase in the preformed fatty acids coming from adipose tissue lipolysis. NEFA and BHB, we looked at those just to make sure that our model actually showed what we were expecting to see, and we see an increase in NEFA and BHB, both of the markers of negative energy balance in a high energy group. Coming to the results of the glucose tolerance test, these are the curves from the plasma glucose at the 4 different time points. The prepartum time points are shown in the top row, and the postpartum time points in the bottom row. As you can see here with the means shown and the standard deviation, there is no difference between the 3 groups. They're also pretty much overlaying each other. You can also see that there is very little variation in the glucose concentration following this bolus. When we analyzed these curves many different ways, we found no difference in the maximal concentration of glucose that was achieved and the time to have maximal concentration, in the clearance rate of glucose, and in the area under the curve. As opposed to glucose, you can see here when I'm showing you the insulin data that there's a lot more variation in insulin response between the different cows. Again, these are means shown with standard deviation. You can also see, again, the prepartum time points are in the top row and the postpartum time points in the bottom row, that the postpartum response is much lower than the prepartum response. When we analyzed this, we found no difference in maximal concentration, time to maximal concentration, time to half maximal concentration, area under the curve, or clearance rate of insulin. NEFA suppression after the insulin release was the same in all 3 groups. Prepartum and postpartum, I'm showing you the 2 time points here, there was no difference between these 3 prepartum treatment groups. So absolutely no difference in the absolute or relative reduction of NEFA concentration or the time to maximal suppression. We were also interested to look at the baseline concentrations, which are the concentrations before the glucose bolus was administered. And as you can see here, prepartum diet actually has an effect on the glucose concentrations at baseline, which has been shown in previous research as well. Interestingly, the high energy group has higher glucose concentrations prepartum, but lower glucose concentrations postpartum, with the same trend numerically continuing at day 21 postpartum. When we looked at insulin, we saw the same parallel changes in the high energy group, with the lowest insulin concentrations also on the postpartum time points. And then we were interested to see what glucagon was doing at the same time, because we saw indication that the glucose levels or homoresis were changed here, and we have an increase in the glucagon concentration in this high energy group. And the last piece of information I want to show you is the tissue insulin signaling. Just a brief introduction into this if you have not studied the insulin signaling pathway. And this is very oversimplified, so I'm apologizing to everybody who's been researching this all their lives. But insulin is binding to the receptor, activates the insulin receptor substrate, and then phosphorylates a downstream kinase, which then has all the effector functions that we see typically from the insulin binding. We then look at this with immunoblots, doing a ratio between the phosphorylated form of this kinase to the total form of the kinase to see how much of the activation we have in this kinase at each time point. And we did this, again, to remind you before and after the glucose administration at the 4 different time points. So the results here in adipose tissue, we did this also in muscle tissue, but I won't have time to show you this. And we're contrasting here the high energy group just to the control energy group to show the biggest contrast. There were no differences in the two groups when they were responding to the insulin in adipose tissue. However, we see a time effect, which was expected, with less baseline activation of AKT after calving, which is shown here on the left-hand side, with letters depicted B, being significantly different from the prepartum time points with A. After the glucose challenge, you see that there's a large increase in the ratio prepartum, the bar graphs on the right. However, postpartum, we could not elicit such a large response in the activation of AKT anymore with our glucose bolus. So overall, the conclusions of what I'm showing you here today are that dry cow nutritional management plays a fundamental role in the prevention of excessive negative energy balance in the absence, at least in our research, of negative effects on early lactation milk production. It affects the systemic glucose availability in the absence of changes in peripheral glucose uptake or insulin response to a glucose challenge. And we did not see any overt metabolic changes in tissue insulin response, here shown in the adipose tissue. With this, I would like to acknowledge my co-authors on this paper, Drs. Neidem, Overton, Washlock, and Leal Yepes, and everybody else who helped with this study, our collaborators, as well as the funding sources that helped fund this research. And if we have time, I would be happy to take any questions. Thank you.
So we have time for one question, maybe two. There are people going around with microphones. If anybody has a question, you might just raise your hand or stand up, and we'll get a microphone to you. I just have one question, Sabine. What influence do you think the body condition score at drying off might have in a study like this, where you're feeding a set energy all throughout the dry period?
Yeah, I think everybody heard the question, but the question was, what influence might the body condition have on the responses that we see in such a study? So in our study, our groups were balanced for body condition, and we basically had almost everybody at 3 or 3.25. So we didn't have a large variation in body condition score, so I can't speak about this based on my own research. I know that other people have done research using cows with different body condition scores, but then they didn't necessarily feed them different energy diets. So we have pieces of information that I guess we can only speculate how they would fit together. But obviously, body condition has an effect on the rate of lipolysis that we see postpartum. So that would have to be taken into account on top of the effects that we have from the diet. What we actually wanted to achieve with this project is to make these cows fat. And I can tell you that 2 months of dry period is not enough to make cows fat, no matter how much you feed them. I don't know if anybody has tried this and has different opinions, but it's really hard to do this if you're feeding a ruminant diet, at least, and keep them healthy. So
we have one question down here, which we have time for.
Bindige from Freie Universität Berlin. In lactating dairy cows, more than 80% of glucose uptake occurs independently of insulin, just by other tissue. So my question is, do you think it is a suitable method to use this glucose tolerance test to assess the peripheral glucose disposal?
Yeah. Yes. So the question was, after calving, 80% of the glucose uptake is insulin independent and largely taken up by the udder, which always takes up a a steady amount of glucose that's circulating, and is that adequate to assess the peripheral insulin response? So you should not compare prepartum to postpartum time points when you look at glucose tolerance tests. Absolutely no, because you cannot compare these. But we were doing comparisons within treatment group, so I think it's a fair comparison to do that. However, if you were just wanting to assess the tissue response independent of the glucose uptake, if there is such a thing, you probably would have to go to the clamp tests to do that. That would be a little bit of a better way. However, we were doing 340 glucose tolerance tests, and I would still probably be doing my PhD if we had done those. And research has shown that the glucose tolerance test is a pretty good approximation to the clamp tests in most cases. But back to your question, you cannot compare the different lactation states, obviously.
Microphone is
I think
on?
there's
Yes.
another question.
There was a significant difference between the groups in milk yield. So that's why I think also between the groups the comparison was not so suitable.
So, I think you said there was a significant difference in milk yield between the groups?
Milk yield, I think, was
No,
there?
there was no significant difference. There was actually, I think we don't have time to go back to this.
Okay.
We can discuss this later, but milk production was not different. There was a numerical separation between energy-corrected milk at these time points just in the first few weeks after calving, because the cows in the high-energy group have more milk fat, higher rates of lipolysis,
Okay.
and then they have higher milk fat, and that's the only difference that we found.
Okay, thank you.
Now, ladies
Thank
and
you.
gentlemen, you might thank Sabine again for a really excellent presentation.
Thank you.